Dr. Dawn Lindsay. She is the Director of Evaluation Services at IRETA. In this capacity, she is the evaluator of the National SBIRT ATTC and oversees other research and evaluation activities at IRETA. And at this point, I'm going to turn things over to Dawn. Dr. Lindsay?
Okay, thank you very much, Danielle. Can you all hear me?
We can hear you.
Okay. So I'm going to show my screen. I just checked just screen, right?
Yes.
Okay. All right. Great. Well, welcome everyone. I'm very delighted to be speaking with you today about evaluation of SBIRT programs. This is a topic that is, I think, one that is interesting to me, I hope interesting to all of you, and one that is, anything worth doing is worth measuring. So really worth taking an hour to an hour and 15 minutes of our time to really delve into all of the activities and all of the planning that should go into an SBIRT evaluation. And anywhere along the line, if you all have any questions, please feel free to, as Danielle said, request to speak or to type your question in the chat box. Because we do, I know it's a webinar, so the opportunity for true interaction is a little bit limited, but we like to do our best to get audience participation if we can. So I noticed in the poll responses that several of you had checked other for profession, and if you wanted to elaborate on that at all, I do like to know, who's in the audience. So I don't know if those were evaluators that didn't have any place to check what they actually did, but if you want to elaborate on your profession in the chat box, you could send a chat to Danielle, and just so I have kind of an idea of what everyone is up to. All right. So today I hope to meet the following objectives to help you be able to identify appropriate questions for an SBIRT evaluation, be able to connect potential sources of data to an SBIRT evaluation plan, and to discuss ways to apply these concepts to your own setting. So what I am basically doing is taking a very well-known model of program evaluation in general and presenting it to you and illustrating the ways that this can be applied to an SBIRT evaluation. So we'll just start with a very general definition of program evaluation. So it is the systematic collection and analysis of information about program activities, characteristics, and outcomes to make judgments about the program, improve program effectiveness, and/or inform decisions about future program development. So that's a lot. It's a very large amount of big words, and we're going to hopefully deconstruct that a little bit throughout the presentation, but I just wanted to show you this right off the bat. So the point I want to make here is that research and evaluation are different. Some of us were researchers in our previous lives. I was a researcher in academia in my previous life, and I'm constantly reminded of how different evaluation is in some ways than research. So I like this quote that says, "Research seeks to prove, evaluation seeks to improve." Now, if you were a real stickler, you would probably say research seeks to fail to disprove, because you really can't prove things with research, but we're not going to quibble about that. The point is that evaluation has different questions than research, and we'll talk about that. So some ways that, not to beat this into the ground, but some ways that research and evaluation are really different are listed here, and I think Danielle might have mentioned these slides will be available to you, of course, as most of our presentations are afterward. So let's see. In terms of program planning, research uses the scientific method of generating hypotheses and seeking to support those hypotheses, whereas the program evaluation plan would really be to apply a framework of evaluation in terms of understanding the process of your program, what goes in, what comes out, and that sort of thing. And you're not necessarily, your goal is not really to prove or disprove in that way. And these are some other ways that research and evaluation are a little bit different. Like, for example, in the design, in a research design, you would seek to isolate changes and control circumstances in terms of evaluation, you welcome changes, you include the circumstances and the context, and it's all, grist for the mill. Whereas in research, you would really try to hone in on those specific variables and the effects of those on your outcomes. And you can read these on your own. But the basic idea is that, while research and evaluation do share certain methods and certain activities, their intent and their purpose is ultimately distinct. Okay. So this is the general framework for public health evaluation that I'm going to be talking about today and applying to SBIRT. So this framework is from the CDC. Many of you have probably seen some version of this before. So there's a 6-step process, and it is circular for a reason, because it is, there's a constant feedback loop in terms of applying evaluation. Like the process of evaluation should be in every aspect of program planning, and it really runs in parallel, the way I see it, to planning a program. So if you're going into a setting, for example, or in your own setting, if you wish to implement SBIRT into your setting, you want to be thinking about these components of evaluation from the beginning. So those steps are engage stakeholders, describe the program, focus the evaluation design, gather credible evidence, justify conclusions, and ensure use and share lessons learned. So again, this is from the CDC, and the link is down at the bottom of the slide. In the center of the loop are kind of commonly understood evaluation standards. We're not going to get into those a lot today. You could do an entire course on this framework and how it applies to various public health settings, but we're not going to do that today. But just for your information, those standards are present in each of the steps. And I can forward along some more information about those if anyone is interested. Okay, so step 1, engage stakeholders. So stakeholders are an extremely important part of program evaluation. As SBIRT champions are a very important part of planning and SBIRT implementation. It's kind of an analogous situation where your stakeholders you want to engage them from the start in terms of buying into the need for evaluation and so forth. So people are so important. So what do you do when you engage stakeholders? You're fostering participation among people who have an investment in the evaluation findings and the use of those findings. Why would you do that? Is to increase chances that evaluation will be successful and useful, and to improve the credibility of the evaluation. So especially if you are a person, as we are sometimes in IRETA, sort of a person or organization coming from the outside and doing an evaluation, you want to engage these stakeholders from the start so that they have an interest and they can sort of pave the way, so you're not seen as much of an outsider in terms of getting in there and performing the evaluation activities. So some of the things that you do to engage stakeholders are consulting them throughout the evaluation process. Again, much like your SBIRT champions, you want them to be there throughout the process. Making special efforts to include less powerful groups or individuals. For example, many plans that would include patients or consumers as stakeholders throughout the process. Okay, so I'm sure there's more than 3, but the 3 major groups I have here are those involved in program operations, management, staff, etc. Those served by the program, patients, advocacy groups, etc. Persons in position to make decisions about the program, so partners, funding agencies, sources of funding, and so forth. So in terms of an application to SBIRT, your stakeholders for an SBIRT evaluation, again, much like an SBIRT implementation plan in general, would be representatives from all the agencies involved, your SBIRT champions, absolutely, staff members conducting the SBIRT activities, insurance providers, county state representatives, funding agencies, the list goes on and on. And it can be as big or small as would be appropriate for your setting. Again, these are some ideas of how you might apply this model to an SBIRT evaluation. Okay. Did anyone have, I'll just pause here. I'm not going to pause after every single step, but I just want to pause for a moment and see if anyone has any questions from the start. Danielle?
There isn't anything out there just yet, but a reminder that you can use the question box or that you can use the chat box for those questions.
That's wonderful. And I could probably see those coming in. Is that correct? If I had one eye on the on the chat box?
Yes.
Okay. So I'll certainly pause if I see a question, but I'm going to just minimize my window so that I can see my slides. Okay. So forging ahead. So step 2 would be where you begin to that happened. Apologies. You start to describe your program. So what do you do when you describe the program? You're delineating all the components and features of the program, including its role in the public health context. Now, we as SBIRT people, we know the role of SBIRT in the public health context, but everyone in your agency may or may not, and that's why it's important to sort of think about these things and put them down in your plan. Like a lot of what I'm talking about today, I feel like is kind of common sense if you think about it. Like these are all, of course, SBIRT champions are important to include, but when you know, the process of making a plan and drawing things out, and when we talk about the logic model and evaluation, this is even more so, more important. It's so important to have everything down in one place so you can really see how things are interacting and where relationships are happening and where processes are happening. It's pretty important. So, again, of course, SBIRT is important in the public health context. Of course, you have the components and the features of your program, and you're going to describe these in some detail. So why would you do this? It allows a balanced evaluation of strengths and challenges and helps stakeholders understand how program features contribute to outcomes and relate to the public health context. So some of the things you would actually do would be identifying needs addressed by the program. So if, for those of you who have an SBIRT grant, for those SBIRT grantees, you have already, in a sense, identified the need because you have the funding. These programs or agencies are doing SBIRT, so that's already set in a sense. But when you're coming into a brand new sort of implementation of SBIRT, one step sort of before you would do that would be to identify the specific needs that might be addressed, that might be implicit or explicitly addressed by the program. Constructing an explicit logic model to illustrate relationships between the inputs, outputs, and outcomes, and analyzing the public health context again. So when a lot of people think about evaluation, they think about logic models. So we're going to talk about a logic model today. We're going to sort of deconstruct the components of a logic model because it really is at the heart of an evaluation plan. So at its most basic form, a logic model consists of inputs, outputs, and outcomes. And you can think of everyday examples of a logic model. So underneath outputs, we have activities and participation. Underneath outcomes, we have short-term, medium-term, and long-term outcomes. So at its most basic form, these are the necessary components of a logic model, and you can expand from here. And most programs do, especially if you're grant funded, you must. So moving on from, in terms of just delineating your inputs, so inputs are the things that go into your program. And just some very basic ideas here are program staff. So a lot of this is going to be your stakeholders would be delineated here. The program partners, SBIRT champion, your evaluator is certainly an input, the funding source, any tools you're using, and again, you can get more or less detailed as you wish or as is required by your grant funding or by your program needs. So that's a little bit about inputs. In terms of outputs, some of the activities that you would include would be all the activities of your program. If you have a grant application, for example, you can look to your application to say, well, what did we say we would do? We said we would do SBIRT training. We said we would do technical assistance or implementation activities, on-site consultation, for example, and these are kind of training grant examples. Or we said that we would implement SBIRT into 5 ERs around the Pittsburgh area, or whatever it is. And the participation, you want to be very explicit about who you hope will participate in the program and therefore in your evaluation. So providers at sites, clients and patients, administration people, again, your SBIRT champion, you want to be involved in every step of the process. Okay. So then we get into outcomes and how we talk about our outcomes. And I'm talking about the logic model now, and we'll again get a little bit more into detail on some of these specific parts of the logic model later. But this is a broad brushstroke right now. So the number of providers trained might be one of your short-term outcomes. So it's the most proximal thing to the activity. So, a classic evaluation question like, what did we say we would do? We said we would do SBIRT training. Did it happen? Well, okay, we know that it happened because this many people were trained. Or the number of people receiving technical assistance, number of patients receiving SBIRT might be a short-term outcome. So in the medium term, you have SBIRT is implemented across some number of sites, for example. And I'm sure you all could come up with other examples, and I hope you do, to apply to your own settings. And then our long-term outcome would include reduced risky alcohol use, improved overall health. So one thing you might notice about long-term outcomes is that they're somewhat difficult to measure, if not impossible. And that's the case, and that's okay, because, again, you're making a big picture here of the ultimate impact that you want to hopefully be able to demonstrate from your program. So the long-term outcomes may or may not be able to be measured readily, but you still want to keep them in your model in terms of, this is what we're keeping our eye on. This is what we ultimately hope to achieve, is reduce risky alcohol use in your population. And actually, there are ways to at least approximately measure these kinds of things if you get into kind of looking at existing data sets like that SAMHSA has, or that some of the government CDC has. You can kind of make an approximation of these long-term outcomes. Okay. So all of this happens in a context. As I mentioned earlier, the context is important and is something you want to be keeping an eye on, not in terms of decreasing it as much as possible or kind of decreasing the effects of it as you would in research, but in terms of, for example, like keeping your project objectives in mind, keeping the stakeholder interests and their level of engagement in mind, and keeping the needs of the program in mind. These are all contextual issues that should be addressed. Okay. And finally, underneath all of this are our underlying assumptions and external factors that we may or may not have control over. But again, this kind of becomes the big picture of our program, and in terms of our inputs, outputs, and what we hope to ultimately see, our outcomes. So this is all, I want to point out a resource now. The University of Wisconsin has an organization that has a huge amount of information on logic models, on constructing logic models, applying them to your settings. There's online courses. There's workbooks. Again, like I said, this could be an entire course just in the finer points of constructing logic models. We obviously don't have a lot of time to go into that today, but I wanted to point out this resource. Like, for example, they have this nice worksheet that you can download and take to your project meetings or your evaluation meetings or your implementation meetings, and really keep in mind all of the components that are at play. Okay, and one thing I want to point out is that outputs to outcomes, you may have noticed in our very quick logic model that I went through that there's kind of a leap between SBIRT happens in our setting and there's some detectable reduced level of risky drinking, or there's some detectable improvement in health. And that is a real phenomenon. Like, outputs to outcomes is a very difficult thing to establish. And again, long-term outcomes are not always able to be measured. But again, you want to keep the end in mind and keep that impact in mind. So then we're down to step 3, where we are going to talk about focusing the evaluation design. So now we're getting a little bit more into kind of research speak here, but describing the program generally falls into, focusing the evaluation design. We want to talk about the types of evaluation that there are. We're talking about defining evaluation questions, and then finally deciding on the evaluation design. And some of this may start to be very familiar to you if you have a research background. So in terms of types of evaluation, there are actually several types of evaluation. I don't know if there are any evaluators by training in the crowd, but I'm going to talk about 2 of them in some detail today, and those are implementation evaluations and effectiveness evaluations. So in terms of implementation, the question here is, has a program been implemented as intended? And this is the best way to kind of illustrate how evaluation and research are different. So research, if you think about the kinds of questions that you see in the SBIRT literature, you don't generally, and there are of course exceptions to this, but you don't generally tend to see implementation questions as the whole point of the article. And again, there are exceptions. But what people are, it seems, most interested in reading about are effectiveness, like, did it work? Has a program led to the intended outcomes? And these are 2 distinct types of evaluation that we will get into in a little bit more detail. These others are, I don't have as much expertise in these, and these are not things that we're going to talk about in much detail today, but I can certainly get you some more resources on them if you are interested. So other types of evaluations include efficiency evaluation. So are programs being run with a minimal use of resources, or as minimal use of resources as possible? Cost effectiveness evaluations. Does the benefit or value of the program equal or exceed the cost? And this is actually a very interesting and very hot topic in SBIRT research, is cost effectiveness. And finally, attribution. So can the outcomes be related to the program, which is a little bit different than effectiveness, although I think related. But in an attribution evaluation, this is more like, again, more like a research question, like, can the actual outcome be related to the program? So if you do see reduced drinking, is it because of SBIRT being implemented in 5 sites in Pittsburgh, or is it because of some other phenomenon that we can't measure? So again, just some ideas of how this might be applied to SBIRT would be, for implementation, is a process focused evaluation. So did what we think was going to happen happen? Are we administering a validated screen? So if our goal and our objective and activity was around universal screening or using the audit or another validated screen, is that happening? Do we have a process to conduct brief intervention when indicated? And, is that happening? As opposed to effectiveness, which would be outcome focused. So did these things make a difference? So we are administering a validated screen. We do have a process to conduct brief intervention and referral. Well, is that making a difference? Do patients reduce their drinking as a result of these things being implemented? So I pulled some questions from the state SBIRT RFAs. So I know many of you on this webinar are state grantees, state SBIRT grantees. So I pulled these out to just further illustrate some of the process questions and the outcome questions that we might have an interest in terms of doing SBIRT projects. So one of those questions, for example, under process, how closely did the implementation match the plan? What types of changes were made to the originally proposed plan? So if you are an SBIRT grantee, presumably, many, if not all of these questions fell somewhere into your grant application, and you're now hoping that you'll be able to demonstrate these things. So what led to the changes in the original plan? What effect did these changes have on the planned intervention, et cetera? How many individuals were reached through the program is definitely a really important indicator of a process plan. So keeping track of numbers and who provided the intervention, what services were provided to whom, in what context, and so forth. So that is sort of a laundry list of examples of process questions. And then we have some examples of outcome questions. So what was the effect of the intervention on the outcome goals? What program or contextual factors were associated with your outcomes? What individual factors were associated with outcomes, including like gender, race, ethnicity, et cetera? Was the intervention effective in maintaining the project outcomes, and so forth? So again, these have been standardized questions that the state SBIRT grantees and the training SBIRT projects, for the most part, have been required to respond to. All right, well, we're about halfway through the discussing the framework, so I want to pause once again. And I can't see my panel, so I'm just going to ask Danielle if there are any questions.
There was a question from Jerry. What are the time frames for the short, medium, and long-term outcomes?
That is a great question. I don't think there's one answer to that question, but thank you for pointing that out, because one of the things that you want to think about in terms of your evaluation plan is timing. And so, I mean, I can give some general thoughts about the answer, but ultimately the answer is going to depend on factors such as it's going to depend on your own program and how long you have. For example, if you're an SBIRT grantee, it's relatively simple to answer that question, because you have to demonstrate some outcomes within 3 to 5 years. But in terms of the short-term outcomes, you should be able to monitor those on a regular basis once you have your SBIRT program up and running. Those short-term outcomes should be, you should be able to be logging those and to be demonstrating those pretty quickly. Like I would say within 3 to 6 months, if I had to throw out a number. And it's not like, evaluation is not like research in that, you're not necessarily going to be establishing that, like, we're going to collect data for 6 months and then we're going to be done collecting data. you may do that. That may be your choice in terms of your plan, but I see evaluation as a really ongoing process. So it starts at the very beginning of planning for your project, and it keeps going through the end of the project. So for example, like for your short-term outcomes, once you have the SBIRT program up and running, you're going to be starting to collect data, and we'll talk about ways to collect data and sources of data in a few minutes. But once you start collecting that data, that's all you should be able to be. You should be able to be demonstrating those kinds of outcomes fairly quickly. And so, that's one answer to the question, is it depends on your program, and you set those times. You can make those decisions. You can say, we want to, and you should actually, in a very detailed evaluation plan, that medium-term outcome would say, SBIRT is going to be implemented in 5 ERs in the Pittsburgh area by May of 2016, for example. And we are going to be able to, we're going to have a baseline measure of like how many patients were screened previously. Maybe it was 0, maybe it was 10%, maybe whatever it was. Maybe at 6-month intervals, we're going to look at those numbers again. I hope that answers the question. I guess the answer is it depends, of course, but that short-term outcomes you should be able to be measuring fairly quickly.
All right, we actually have 2 more questions.
Okay.
The first says, on the last slide, what is the HIE?
HIE. That is a very good question. Shame on me for putting this slide on without knowing what HIE is. I will have to get back to you on that. I'm not sure. That's a SAMHSA term that I'm not familiar with. I apologize.
A few supplied health information exchange.
Yes.
Okay.
That is what it is. That was a
Okay.
SAMHSA grantee who said the word escaped me.
And then another question, plus comment. It says, I am used to seeing behavior change in the outcomes, not numbers served. Can you comment?
Let's see. Let me go back to my. So in the short-term outcomes, right? So there are different ways to do logic models. I tend to make short-term outcomes very attainable, and I would definitely consider, so behavior change meaning if it was a patient-oriented SBIRT project, I would say behavior change is more of a medium-term outcome. Although you could consider like number trained and number of patients receiving SBIRT could be a participation item. And if you wanted to get right into short-term outcomes of behavior change, that's definitely a very legitimate way of setting things up. Are there other questions?
Those are what we had come in at this time.
Okay. All right. Okay, so in step 4, according to the CDC framework, we have gathering credible evidence. So here's where we start collecting data. So I'm going to talk about a few different aspects of gathering evidence. We're going to talk about what we mean by indicators, data sources, data quality, quantity, and logistics. So indicators are, and this is where we want to be very specific about our program components. We want to have observable and measurable terms. So if your process is SBIRT training, for example, so did SBIRT training happen or not? What do we mean by that? Well, an indicator, and these are totally examples that I just made up. An indicator might be a 4-hour SBIRT training will be offered to all intake workers at all sites in the program. 80% of the workers will attend. Now, that's not really an indicator, but it's more of an outcome or participation. But that would be an example of how to really get our arms around what exactly do we mean by an indicator of SBIRT training. If SBIRT screening or SBIRT implementation was the process you are interested in, your indicator may be 80% of patients will be administered a validated screen annually, for example. And there are also outcome indicators, of course, so there are process and outcome indicators. So reduced drinking might be an outcome you're interested in. And an indicator of that would be patients report 3 fewer drinks per week at the 1-month follow-up or 6 months or 1 year. Again, you can craft this, whatever makes sense to your program. These are just to give you some ideas of, you want to include very quantifiable things when you're constructing your indicators. Okay, so we want to talk a little bit about data sources. So it's worth thinking about where your data are going to come from. And in an evaluation, it is definitely optimal to have data from several sources. The multi-method evaluation is kind of a buzz term these days. So we want to have both quantitative and qualitative data, preferably, and we want them to be coming from different sources. So primary sources would include surveys. So maybe you already, in your agency, perhaps you already have patient surveys that patients complete at their annual visits or so forth, and you may draw data from there. You may use that as a data source. You may be able to add items to surveys that patients already get. So one way of making SBIRT implementation easier is, of course, embedding it into the day-to-day operations of the agency that you're dealing with. So if they already have survey data that they collect at whatever frequency they collect it, you may look at that as a primary data source. You may conduct focus groups with your stakeholders, or you may do observation of clinical encounters or observation of the SBIRT screening and brief intervention if you're interested in evaluating like competency of your providers, you want to be doing direct observation. Document review, like chart review, may come into your evaluation. If you are interested in, if your agency has been collecting information about substance use or alcohol use, for example, you may be able to gather enough data to have kind of a baseline measure of overall use in the patient population, and then you can, although that's getting a little bit more like secondary data, but then you can have a baseline measure to then use as a baseline to hopefully see changes over time. And then some secondary data sources would be existing data sets, and I mentioned this a little bit previously. To get at kind of your longer-term outcomes, if you have a very large, some of the state SBIRT grantees, for example, if you have a very large initiative in a county or in a state, you may be able to use existing population surveys of alcohol and drug use to demonstrate, to demonstrate your long-term outcomes. Like you may be able to see a change in overall reporting of alcohol or substance use. Okay, so and I already talked about some of these, but some SBIRT examples of sources of data would be initial screening scores of the audit or the DAS or whatever instrument you're using. Some indicator or some measure of the interventions undertaken, and again, this, you can kind of be creative with this. You can do observation of the brief intervention if you have the facility and the ability to do that, or you can use case notes, like progress notes that the clinician would complete, and that's all data. Any referrals that may be made would be a source of data, and it's referral to treatment has been a more difficult issue in terms of SBIRT research, certainly, and it's worth considering in terms of your evaluation plan how, what the source of that data will be. Are referrals made documented in the electronic health record? Does the agency have an electronic health record? If they do, are referrals always documented there? Or, what way could you gather that information? Because you'll want to have that information. Okay. So then follow-up screening scores or outcomes, treatment utilization, or other SBIRT-related examples of data sources. Physical and mental health symptoms or diagnoses, next scheduled screening. These are all sources of data that can be used to measure your indicators of interest. Okay, I want to talk about data quality a little bit. So, as I'm sure you know, you want to ensure that your data are reliable, valid, and useful if there could be any use to your evaluation. So the design of the data collection instruments is really important. They need to be easy to, if you're designing data collection instruments, if you're not just collecting data that already exists. You want to design those instruments to be very user-friendly. You want to consider the reading level. Like if your population of interest is adolescents, you may want to consider their desired modality, maybe something electronic versus a paper and pencil, for example. So your data collection procedures, you want to consider the logistics, like who is going to collect the data and where are they going to do it? Is it going to be in the waiting room? Is it going to be in the exam room? If you're in an ER, is it going to be during triage? Is it going to be at discharge? Or where is all this going to happen and by whom? Are all questions that are important to consider and may lead to better or not so great data quality. The level of training of the people collecting the data is obviously really important. How you're selecting your sources, how the data are coded, and data management issues all fall into this. Okay. So quantity, I just want to say a few words about this in terms of data quantity. So this refers to kind of how to determine how much data you really need. Because I think in terms, in all the things we've been talking about, it seems like more data are better. More data are always better for an evaluation. It's not necessarily always true. You do want to have enough data to be able to make conclusions about the program, but you don't want to be overwhelmed by conflicting and by kind of too much. So I just wanted to make that point that you want to think about that. So logistics, I think we've already talked about this a little bit, but this refers to just the procedures by which you're going to collect your data. So who is collecting the data, when, how often, how will security and confidentiality be maintained? That's a big issue, especially when you're collecting sensitive information about alcohol and drug use and so forth. All right, we are getting to the end of the circle here. So we're going to talk about justifying our conclusions next. So in terms of justifying conclusions, this is the process by which we take all of the data that we've collected and try to make sense of it, basically. So the steps here involved are analyzing and synthesizing our findings, identifying the standards by which we're comparing the findings, we interpret things, and make judgments about the findings. So the very first step, of course, is checking data for errors and tabulating things. So the number of participants receiving program components would be, again, a source of data that we've been talking about. Number of participants achieving desired outcome. We want to compare our results with similar programs, compare the results with stakeholder needs, and interpret findings and make judgments. And context is, of course, important. So any data you collect is in a context of the program. And again, many times in research we consider context to be kind of in the way of our question, but in evaluation it is primary to our question. What we're trying to determine in evaluation is, does the program work in this setting given the parameters that we have established? Does it work? In research, our question is a little bit different. We're trying to generalize our findings to several settings, and so context would be something that we would want to keep out of the way or minimize. So then the last step in this framework is ensuring use and sharing lessons learned. So what we're talking about here is, wrapping up the evaluation findings and sharing them. So if the purpose of evaluation is to improve, no evaluation is really complete unless the findings are actually applied to the program. You don't want the evaluation findings to sit on a shelf. You want the process to be part of a continuous feedback loop. So, why we do this is to truly demonstrate effectiveness. We need to be able to share our findings and share the lessons learned, to identify ways to improve the program, to modify planning, to demonstrate accountability, and really justify the funding if you're funded to do the program. Okay. And this is where I hope we have some examples from you all in the audience about SBIRT evaluation. So I had a couple of examples here. So for example, if you found that the number or the percentage screened was lower than you had anticipated, why was that? What could we do to change it? So maybe your focus group with your stakeholders, pointed out that, well, during triage in an ER setting is really not the time to do screening. Maybe it's during discharge instead. And only by having this data finding and then being able to put it in a context and being able to have that information from the people in the trenches doing the project, you were able to put all these pieces together and make a change to the program, and then that may or may not have made a difference, and that's again the next sort of cycle of evaluation. You may make modifications to logistics, like the modality of screening. Maybe it didn't work to have the kiosks in the waiting rooms because maybe like the computer was always down and they were never working, so patients didn't get screened, for example. Again, that's just off the top of my head. Or maybe the timing was wrong and so forth. So these are just some ways that you can use your evaluation to actually make improvements to your program. Okay, I'm going to pause here because I'm actually pretty close to the end of my prepared presentation. So again, I wanted to leave time for questions and for discussion if you all have more questions. I want to share the resources that I drew on for this presentation. So again, the CDC Evaluation Framework is a great resource. It gives a very nice summary of the ways that you can apply evaluation to public health context, not only SBIRT, but any public health issue. And of course the TAP 33, which many of you probably have much knowledge of if you're SBIRT people, the system level of implementation of screening, brief intervention, and referral to treatment. This has a very nice summary of the cross-site evaluation that was done with one of the SBIRT cohort, that state SBIRT cohorts. And I want to thank you. And again, hopefully start a discussion now and take some questions.
Okay, we do have a few more from the question box. Jerry asked, please describe how the EMR might be used to assist in evaluation.
That is, again, a great question, and I hope that we have some folks in the audience who have some experience in this. I can make some general comments, and then again, I hope others can chime in. I think that the electronic record can really take evaluation of SBIRT to the next level, in my opinion, because you have not only a great source of baseline data, but you can really demonstrate change over time. And let me take a step back and say, in terms of SBIRT implementation, I think that when or if a program is able to really streamline SBIRT and truly embed it into the electronic record. So I know, when you go to the doctor nowadays, they pull up a laptop or they go to the kiosk. Everything is done in that electronic environment. So of course that's data input, and whatever you input, in theory, you should be able to output. Now, there are whole job descriptions that are all around that process of pulling that data out of the electronic record. So it's not always as straightforward as it seems like it should be. But the short answer is the electronic medical record should really take what we're able to do in terms of SBIRT implementation to the next level. Do others have comments about that?
As a reminder, you can raise your hand and I'll unmute you. I could also unmute everyone if there's an interest. I don't know. Okay, so it doesn't look like there are any requests to be unmuted.
Well, maybe we could move on to the next question, or maybe Jerry has a follow-up question to that. I'm not sure if I adequately addressed what he was trying to get at, but I think the electronic medical record is very exciting in terms of the ways that it can be applied and used, really, mobilized for evaluations of this kind. And really not only SBIRT, but just to be able to have more immediately available, data about, what you're doing with patients. You know, because in the past, when everything was on paper, we largely relied on the, you know, sort of the subjective notions of what providers thought they were doing in a sense, and I don't mean that in a pejorative way at all. We just didn't have the easy access to the objective data that we do now. So I think it's really exciting the ways that it will be able to be used.
All right, the next question we have, as we shift from the legacy to the DCI, can you recommend any guidelines for how to address changes in outcome measures in midstream?
That's a good question. I have a call about the DCI like right after this webinar. Let me think about that for a minute. My understanding, and again, I'm going to make a disclaimer here and say I don't really know the answer to that, but I'm hopefully can provide some thoughts. My understanding is that many of the items on the surveys are going to be the same. That is my understanding. That is my hope. I mean, that is my understanding. If the new instrument is, you know, a lot different than the old one, that's going to, obviously, the reason you're asking the question is that's going to really mess with our ability to track things over time. The one, I mean, gosh, hopefully, I mean, I really hope that we are able to draw, you know, I hope that some of the items are at least similar. So, you know, we may not, of course, it's not going to be easy. It's not going to be, you know, very streamlined, but hopefully somebody's working on this and can, you know, give a little bit of guidance in terms of, you know, how we are going to track that over time. So, you know, like some of the indicators that the scale produces and some of the subscales are surely going to be different. But you know, again, like we're all waiting around to see what's going to happen. Really, a great question though. It is, you know, if you're in the pool of people who are using that as a primary evaluation measure, even just one of your evaluation measures, it is, you know, it's definitely an important consideration, and I don't know the answer. Is there a follow-up question or any other thoughts?
Follow-up is, what is the DCI?
Oh, I think that what that person was referring to was the new, like we're moving away from so the measure previously was the GIPRA, and they're changing that measure. So the measure of the patient measure that was being used for the state SBIRT grants, and not only state SBIRT grants, but any patient-focused SBIRT SAMHSA grants is changing.
Okay, and another acronym with a question mark. What is CDP?
Yeah, the CDP is the new, okay, so previously the GIPRA data were collected on a platform called SAIS. I know more acronyms, SAIS. And the new system is called the Common Data Platform for CDP.
All right, we had another question just as far as accessing the slides from today's webinar. Those will be sent to you by email. So, nice, simple question.
Yep.
I like that one.
And again, I'm very happy to, you know, to send along it was just it was more than we could get into today, and I was hoping that people could maybe share their experiences in terms of SBIRT evaluation and any barriers they may have come up against. But again, I would be happy to forward you some more of that information about constructing logic models and so forth, because that really is a great resource. So we can send that along with the slides, that link, Daniel.
Great. We haven't had any other questions come in, but a few thank yous for the responses.
Sure. Yeah, I mean, again, I'm happy to end early, or I'm happy to stick around if anybody has any other discussion.
And remember, you can raise your hand, and I can unmute you if you want to speak directly. In general, we will email out to you your certificate for attending, as well as the PowerPoints and a link to the recording once we have that up and live on the website. So those will be coming to you in the next few days.
Thank you all so much for attending and for your questions. Again, if you find that you have another question after logging off, feel free to, my email is here on the screen, or feel free to reach out.
Okay, so a question did come in.
Okay.
Have you had an EMR to collect and analyze data?
I'm sorry, what was the question?
Have you had any experience using an EMR to collect and analyze data?
I'm afraid that I personally have not, but I can certainly direct you to folks who have experience in that area. So if you want to get that person's contact information, I would be happy to follow up with you on that to get some more information about that. Yeah, I do apologize. I don't have any deep level of knowledge about the nitty-gritty of doing that, of mobilizing that EMR platform to to contribute to the evaluation. But I definitely would like to connect you with someone who could talk with you more about that. If you want to, if that a person has could follow up with what system they are using in their setting, that would give me a little more information about who to direct them to. The systems are, if you're in the position of being the data person who's really getting in there and trying to get information out, the systems are pretty different. So it would be helpful to know what it is that they're using.
So Jerry, if you could provide that in the question box along with an email, that would be great. I can pass that along. And if there aren't any other questions at this time, I want to remind everyone, Dr. Lindsay did put up her contact information, but you can always email us at info@ireta.org. That's info@ireta.org. All right, well, nothing additional come in, so maybe we can close up for today.
Okay. Thanks so much, everyone.
Yeah, we do appreciate you attending, and please do reach out if you have questions. All right, thank you.